Hello. Vertigo is the sensation where you feel that you or the world is spinning or moving, which at times can make you feel nauseous. It can be a very troubling symptom which can limit your ability to undertake everyday tasks. Vertigo is caused by problems with the part of your ear which helps to control balance. Evidence shows that you will recover much more quickly if you continue to move around despite the symptoms. In this video, we will show you some exercises which are known to successfully treat vertigo. Firstly, it's important to understand that these exercises are designed to make you feel dizzy. It's only by making you feel dizzy that they will be effective. In essence, by doing these exercises, you are recalibrating the balance control system. This means that each time you do the exercises, you need to do them at a speed that makes you experience a mild to moderate amount of dizziness. This dizziness should settle a few minutes after doing the exercises. However, if the dizziness is very severe or lasts for more than 10 minutes, you should slow down the movements or do fewer repetitions. We suggest that you start with the first couple of exercises and add more as you feel able. It is not necessary to do them all at once, and they can be split up over the course of a day. You will get the most benefit from doing each exercise twice a day. You can do the first few exercises either sitting or standing. We suggest that you start by doing them sitting down, and as you progress, you can do them standing up. It is best to do each exercise every day for 4 to 6 weeks, and over this period your dizziness should gradually reduce. Remember, it is normal to feel worse before you start to feel better. You could also assist your recovery by trying to make yourself mildly dizzy when doing everyday activities, such as hanging out the washing or loading the dishwasher. Even playing ball games with your children or partner can help. In addition, you should try to go for a walk every day. You may like someone to be with you initially, and even a 5-minute walk will help. Gradually increase the distance you travel as your symptoms subside. Stick 2 cards with the letter X drawn on them on a wall 2 to 3 meters apart at eye level. Sit or stand in the middle of the 2 cards about a meter away from the wall. Now move your eyes and your head to look from one object to the other. Repeat this 10 times and then rest until the dizziness settles. Try to repeat the sequence 3 times in total. From a standing or sitting position, choose a spot on the floor in front of you and a spot on the ceiling above you. Move your eyes and your head to look from one to the other. Do this 10 times before resting. Let the dizziness settle before repeating another 2 times. For this exercise, you can either sit or stand. Bend forwards to touch the floor, making sure you move your head downwards too. Then return to an upright position. Do this 4 or 5 times. For a slight variation on the previous exercise, sit or stand with your knees apart. Move your head toward one knee, then return to an upright position, before bending down to the same knee again. Try to do this 4 or 5 times before repeating with the other knee. Place 2 chairs facing each other 2 to 3 meters apart. Sit down on one chair before standing up, walking to the other chair and sitting down again. As you turn to sit down, remember to turn to the right for one chair and the left for the other one. Repeat this sequence for 2 to 3 minutes. Stand in a corner with your back to the wall. Turn a half circle so that you are facing the corner and then turn back again. Repeat this 4 or 5 times in each direction. Try not to touch the wall unless you feel unsteady. From a standing position, bend down to touch the floor and then stand up again. Next, turn to the left and bend down to touch the floor behind you. Stand up straight again before turning to the right and touching the floor in front of you. Repeat this sequence 4 or 5 times. Find an open area in your home or at work where you can walk back and forth. As you walk, slowly turn your head from side to side for 2 minutes. You can then try moving your head up and down as well. We recommend that you do this inside at first, so you feel more confident. To advance the exercises, you can repeat them with your eyes closed. For your safety, do not do the exercise involving the chairs or the walking exercise with your eyes closed. If you are struggling with any of the exercises or are not noticing any improvement after a few weeks, please contact the physiotherapy department for advice.